you everyone for joining today's special topic webinar, Preparing for Your Doctor Appointment. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. And before we get started, I want to go over a few points. If you have any questions, you can type them into the questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have the time to answer your specific question, we will follow up with you via email. Of course, we will provide the contact information for both the Lupus Foundation of America and NeedyMeds. This webinar is being recorded and will be available for viewing on our YouTube channel. You can find the PowerPoint slide decks in the handout section of the GoToWebinar control panel. So with that, let's get started with what is NeedyMeds. For those of you not familiar with us, what you are looking at on your screen is our mission statement, our vision statement, and a statement about how we achieve our mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. What you are looking at now is the home page of our website, which really is the face of our organization. And as you can see, it is full of information, so I encourage you to browse the site when you have time. For now, I just want to point out a few resources. If you are looking for healthcare cost savings programs, you will want to begin your search with the Patient Savings tab. The Advocates tab is where you will find our educational information. You can sign up for webinars, our monthly newsletter named Vitals, and order brochures, for example. I mentioned that today's webinar is being recorded, and you will be able to find that recording on our YouTube channel, which you can find at the top right hand of our homepage with the rest of the social media icons. It's the third one from the left. So let's get started with today's presentation. As you just saw, an important part of our mission is educating people. And we do that by letting people know about NeedyMeds and the resources we offer, but also by letting them know about other ways to stay healthy, which is why we are so pleased to have our guest from the Lupus Foundation of America here with us today, Ashley Holden. So first, let me tell you a bit about the Lupus Foundation of America. They are the largest publicly supported lupus organization devoted to solving the mystery of lupus, one of the world's cruelest, most unpredictable, and devastating diseases. Through a comprehensive program of research, education, and advocacy, they lead the fight to improve the quality of life for all people affected by lupus. Now, let me tell you a little bit about our guest. Ashley Holden is a health educator at the Lupus Foundation of America's national office. Ashley received a Bachelor of Science degree in Public and Community Health from the University of Maryland and a Master of Education in Health Education from Pennsylvania State University. She is a nationally certified health education specialist from the National Commission for Health Education Credentialing. With this webinar, Ashley is going to provide tips to make the most out of your next medical appointment. After all, the more prepared you are, the more likely you will be able to discuss the issues that are most important to you and leave your doctor's office with a plan in place. And since May is Lupus Awareness Month, Ashley will also discuss the Lupus Foundation of America's mission and resources. So without further ado, I'm going to pass the mic and the screen to our guests, so bear with me. And with that, Ashley, you should be able to grab the screen. And to our audience, while Ashley is pulling that up, I want to remind you that, again, if you have any questions, you can go ahead and type them into me in that questions section of your GoToWebinar control panel. Thanks, and enjoy the presentation.
Thank you so much, Carla, and it's an honor to be here presenting to everyone this afternoon. And hopefully by now you can see my slides. And so as Carla mentioned, today I think it's really important to talk about preparing for a doctor's appointment. And even though I am a health educator with the Lupus Foundation of America, this information really applies, to anyone with any kind of disease. There's a lot of preparation that goes into, prepping for that doctor's appointment. And as Carla mentioned, it is Lupus Awareness Month for what's left of May. We've had a couple of different events going on throughout the month. And, as I mentioned, while we're focusing on how to prepare for a doctor's appointment today, I did briefly want to mention just some information about lupus awareness, because low awareness really results in a late diagnosis, increased morbidity, and increased cost. And it really shows the importance of why we should be preparing for our doctor's appointments. If you look here, you can see that when it comes to lupus, it takes at least 4 doctors to receive a diagnosis. And on average, it's about 6 years to receive a lupus diagnosis. So there's a lot of preparation that goes into getting ready for those doctor's appointments to hopefully get a diagnosis and get some answers as to, what is going on with someone. And, just some background about the Lupus Foundation of America, or LFA, as you'll see it abbreviated here. We have a lot of different ways to get involved with us, and these are just some snippets of those ways to get involved with us. We have walks all across the country, and they go on. You can have teams to raise awareness, and just a lot of good stuff with those walks. We also have ways for people to become an advocate and work with us with our government relations to commit to advancing lupus research. We have a lot of different fundraising opportunities as well, whether that's just donations or starting your own fundraisers. And we also really aim to spread awareness, and we ask for people to share their stories. We really hope to showcase how lupus changes people's lives and the impact it's had on our friends, families, and communities. And so we ask that lupus patients share their stories so that we have those in our arsenal, whether we share those for media interviews or even those experiences with legislators. We want to make sure that we get those voices heard. We also have a variety of different programs and services. And again, some snippets of different things that we have. We have the National Resource Center on Lupus, or sometimes it's abbreviated the NRCL. And so we have a lot of different good information on there, and that has the most up-to-date resources and information on lupus. We also have a monthly educational video series that focuses on just different things related to lupus, and we call that the Expert Series. And so we do have a different expert that speaks each month on a different topic. We also aim to really support our constituents. And so we know that in some areas there just aren't face-to-face groups, or sometimes people just aren't able to make it out to those groups. And so that's where Lupus Connect comes into play. That is an online community where people can engage with others that have lupus, or even family members. We also have Take Charge, and this is our education series designed to help individuals take charge of their lupus. And over the course of 8 weeks, people with lupus will receive a weekly email from our health educators with self-management tips and resources to empower them with knowledge and skills to better manage their lupus. We also have a National Health Educator Network, and so I am part of that, and that's where we have health educators available to answer questions specific to lupus, whether that just being helping you find resources or answering questions to help you get a diagnosis potentially. We have some other resources like a questionnaire that talks about could it be lupus. We encourage people to take that if they think that they may have lupus, and they can print those results and take them to their doctors. We also recently launched Inside Lupus Research, and this is a one-stop location for learning about the most important lupus research news that matters to people with lupus, or have a loved one with lupus as well. But we really try to share early discoveries from clinical trials or new treatment breakthroughs. And then we also just have a variety of other things centered on research, whether it be a registry that's called Research for Me, and that's an online data collection tool where people can share their experiences about the disease. And by sharing their stories, they're playing an important role in accelerating lupus research and treatment. And we also, in different areas and markets, have local support and programs as well, such as our local chapters and support groups.
Ashley, excuse me, I just wanted to interrupt. Thank you so far for this great presentation. And I just wanted to give you a heads up that your audio is coming in and out a little bit occasionally, so your microphone may simply be moving around. So I just wanted to double check with you and just make sure that our audience was hearing you loud and clear as well. Thanks, everybody.
I apologize about that. Hopefully it'll be good as we break into the chunk of the information here. Is that better?
It is. It's much better. Thanks, everybody.
Okay. Sorry about that again. So here's the information that I think everybody probably really came for, how to prepare for your doctor's appointment. And I've really tried to break this down into 5 main areas when it comes to preparing for an appointment. So first, I think that it's important to talk about how to be patient when it comes to appointments. So your first opportunity for a good visit to the doctor comes when you schedule your appointment. You want to make sure you take the time to talk to the staff about the visit you're scheduling so that they can make sure they schedule enough time and can take care of your concerns during the visit. If you have urgent concerns, let the staff know. They may be able to work you into the schedule, but be prepared to wait a little longer in the waiting room. And remember, it may take a few weeks to get an appointment as a new patient, especially if it's with a specialist. We know that sometimes it can take longer to get those appointments with a specialist, especially as a new patient. And you also want to keep in mind that you may need multiple appointments if you have a long list of concerns or if your doctor is working to give you a diagnosis. So sometimes I know it can be frustrating, but it may take multiple visits until you can get all of your answers, especially, like I said, if you're working towards a diagnosis. And when you can, try to make your appointments at least a couple of weeks in advance, or even longer if it's your first visit with a new doctor. This will give you time to prepare for the appointment and allow for time for you to transfer medical records from your other care providers. You'll also want to keep a list of your current care providers. So when you're scheduling appointments, you can organize those appointments on a calendar or use a calendar on your phone to help keep you organized. You can also put all of your doctors in your contact list in your cell phone. If you can, you'll want to try to include their name, specialty, and address. You'll be able to access their information no matter where you are. So if you're traveling and you need to get a hold of your doctor, or if you're not home and you have something come up, you'll have that information with you in your phone and you'll be able to reach out to that doctor to get your answers, or at least leave a message with the nurse so that they'll be able to give you a call back. In some cases, you can also ask your doctor's office or your health insurance provider if they have social workers or care coordinators. This is really important if you have a complex case or you have a lot of different conditions or a lot of different doctors. They can help arrange and organize specialist appointments, and they can also help you prepare for your follow-up appointments or future consultations. So you'll also want to make sure that you're coming prepared. So you want to make sure that you have different things prepared with you to bring to that doctor's appointment. So you first want to work on organizing that medical history that you have. The greatest part of your doctor's understanding of what's happening in your body will be based on your description of your symptoms, both now and in the past. While the doctors also need to examine you and look at results of your laboratory and imaging tests, your personal history gives valuable information. The more organized your medical history is, the easier it will be for your doctor to begin to consider possible reasons for your health complications. You'll also potentially want to keep a binder or folder with copies of your medical records. The binder will help keep you organized and keep all of your important papers in one place so that you won't have to hunt down that information before your upcoming appointment. You can keep copies of your visit summaries, list of your current doctors, and current medications in that binder as well. I mentioned it's really important for your doctor to have a good understanding of your symptoms. So you can track your symptoms before that doctor's appointment. A lot of people find keeping a journal of their symptoms or using some type of symptom tracker is really helpful. You can include a timeline and descriptions of symptoms. You also maybe want to keep track of symptoms that you've had but have disappeared. And you can find a lupus checklist and a lupus, different things to help keep track of your lupus symptoms, or you can even see what these look like for other conditions on our National Resource Center on lupus. And you can see the links on the slides. And I know that you have the handouts as well, so you'll be able to take those links with you. And here's just a screenshot of what those kind of look like. You can see what the lupus checklist and the impact tracker look like. And like I said, if you have some other type of disease with different symptoms, this just gives you an idea of something that you can create in your own journal. So a couple of other things that you want to make sure that you're preparing in advance of that appointment. You want to make sure that you have an updated list of your medications and supplements. So your doctor needs to know what medications you're taking, including those prescribed by other doctors, any dietary supplements, so things like vitamins and minerals, anything like that. And you can either create a list, and on that list, you want to make sure that you have a medication name, dosage, frequency, who's the prescribing doctor. Or you can also bring all those medications and supplements, whether they're prescription or non-prescription, in their original containers to the doctor's office. I know that sometimes when I have doctor's appointments with a new doctor, I will take a picture of my medication labels. And then when I'm filling out that new patient paperwork, all I have to do is pull up that picture and I have all the information right there to fill in, whatever that looks like at that doctor's office. A lot of times it's a chart that I'm filling in. But that way you really want to make sure that your doctor understands that dose that you're taking and how often you're taking it. And even they understand the refill schedule. So maybe, they need to know that you like to have those medications refilled on a 3-month, a 90-day supply every 3 months. Or maybe it's something that you get filled every month. They also need to know if you have any prescribed medications or even any dietary supplements that you're not taking for some reason, whether it be side effects or cost or maybe some other reason. They need to know that too. And any side effects that you've noticed after taking a product, whether it be a prescription medication or a non-prescription medication over the counter, you should also tell the doctor about those side effects as well. And something else that is really important prior to getting to that appointment is creating a list of questions. So prior to your visit, make a list of topics and questions you want to discuss with your doctor or your care provider, whether it be a physician's assistant, nurse practitioner, and prioritize those topics and questions that you feel are the most important for that care provider to hear about. And that way, if you don't get through the whole list, you will still have some of the most important questions and concerns addressed. It's also important to anticipate what the doctor will ask you. A lot of times their questions will apply mostly to your symptoms. And so think ahead about how you would answer those questions. You can see several different questions listed here, just some sample questions of things that a doctor might ask about, what's going on. So it's also important to be informed. And when I say be informed, I mean that it's important to understand your disease or your condition. And you should understand your disease or condition before going to the doctor. If you have information about the disease, you will be better prepared for the appointment. Learning as much as you can before an appointment can help you recognize different terms that the doctor may use. You might understand some of the some of the tests the doctor may mention, and it can also potentially ease anxiety about the diagnosis process. Different types of doctors that or specialists include rheumatologists, dermatologists, cardiologists, nephrologists, gastroenterologists, pulmonologists, just to name a few. So keep that in mind as you're understanding what disease or condition that you have, or the potential condition that you might be diagnosed with. Know that there's different types of doctors that you may need to see. So it is Lupus Awareness Month, and I think that lupus we can use as a really good example of how we can be informed about a disease. And I won't spend a lot of time about it, but I think that it really gives you a good idea of just understanding general information about the disease. Will give you a good idea when you go to that doctor's appointment. So if we take a look at this, what is lupus? Lupus is a chronic autoimmune disease. It can damage just about any part of the body, from organs, the skin, the joints. And a chronic disease means that signs and symptoms may last for many years or may not go away at all. In lupus, symptoms come and go, so they may not be present all the time. Just because symptoms are not present all the time does not mean that someone doesn't have lupus anymore. It also helps to understand who gets that disease. In the case of lupus, lupus can develop in anyone, male or female, of any age, including children, teens, and adults. However, lupus does mostly strike women of childbearing age. But like I said, men, children, and teenagers can get it too. So lupus is different for each person. And you can see there's a wide range of symptoms here. So that's where a symptom tracker really comes in hand. It's very handy. It's very useful because you can track what those symptoms are that you're having, and it'll help a doctor get the big picture of what's going on, and say, yes, these symptoms are related to this disease, or maybe some of these symptoms you have are related to something else. Let's go through this process and see which one it is. And so, as I mentioned, you may want to be familiar with how that particular disease or condition is diagnosed. In lupus, the doctor takes a look at someone's medical history and any symptoms they have currently or in the past. They also take a look at family history. And all of that information is really important because there's no single diagnostic test for lupus. So the doctor will use a variety of tests to help them see the big picture of what's going on, but they're going to use all of that information. And depending on what type of lupus or what type of organ involvement there is, there may also be tissue biopsies. So, as you can see, the diagnosis process can be complex with lupus, and being familiar with the disease, even if it's not lupus, can help ease anxieties and help the process. In this case, lupus is a disease that's known for being difficult to diagnose. Just because the symptoms are different from person to person, they can come and go, and they mimic the symptoms of many other diseases, whether that be rheumatoid arthritis, blood disorders, fibromyalgia, diabetes, thyroid problems, Lyme disease, or even a number of heart, lung, muscle, and bone diseases. So you can see why, if you're informed about your disease and you have a good idea, it'll help things will make more sense as the doctor's talking and as you are going through that diagnosis process. Or even if you're already diagnosed, it'll help you make sense of what you're being sent for, even if it's just routine blood work. Communication's key. I think that communication is key in most of our lives, no matter what it is. So the biggest thing during your visit, remember to bring all of that information you prepared. So bring your medical history, your prescription history, that symptom tracker, your list of questions that you worked so hard to prepare. All of that information will help give your doctor a clearer picture of what's happening with you. To ensure the best management of your disease, it's essential to create a partnership with your healthcare team that includes clear communication. Be sure to tell your physician about any changes in your symptoms. This can help during your evaluation and when ordering tests to ensure that your doctor has the best understanding of your current health. You also want to be sure to tell your doctor everything that you're doing that could affect your health. Remember, your appointment is confidential. So are you taking any over-the-counter medications for a different condition? Or are you on a new diet? Do you have any stress at home? All of these things could impact your health, even if it's emotional stress. When you talk to the doctor, be as specific as you can about each symptom, when it occurred, and how it affected you. And also, don't be embarrassed. Your doctor has heard it all. So if you're planning on discussing a personal topic, one way to avoid nerves is to practice what you plan to say in advance. You'll also probably want to take some notes, especially if your memory is not as good as it once was, or sometimes we just get home and we have a difficult time remembering everything that doctor said to you. So it's always a good idea to bring paper and a pen so you can take notes during the appointment. You may also ask the doctor, nurse, or pharmacist, whoever that care provider is, even outside the doctor's office, to write down instructions for you or to provide you with printed information about your condition, medications, or treatments. This allows you to review information after the visit in the calm of your own home. You can also share these notes with friends, family, and caregivers to help them understand how they can best support you in managing and treating your disease. Some doctor's visits may make you feel emotional, stressed, or rushed. It can be helpful to have a supportive family member, friend, or caregiver accompany you to appointments. They may also be able to help you by taking notes or helping you recall what was said during the visit. And most importantly, try to keep an open mind. If you go to a doctor's appointment with a fixed idea about what is wrong, you and your doctor may overlook a key aspect of what could be causing the problem. So keep that in mind. I gave you that example of how lupus is a really complicated disease and it's very complex to diagnose it because it mimics a lot of other diseases. So if you go in with a set mind that it's one of those diseases, you might be overlooking a piece that says maybe it's mimicking another disease, and it might prevent you from getting the proper diagnosis. And finally, don't forget to ask questions. So don't hesitate to let your doctor know about any questions or concerns you may have. It's best to be proactive in voicing questions and concerns, as opposed to depending on your doctor to ask the right questions. If you have any doubts about something the doctor has said, don't hesitate to continue asking questions until you feel satisfied with the answer. So on the slide, you'll see that there's some sample follow-up questions you may want to ask your doctor. And we actually have a couple more there. So before leaving, you can request a visit summary and follow-up summary instructions. And so you can, at that end of the appointment, your doctor will go over what was discussed, decisions about treatments, if any of those decisions were made at the time, and any suggested changes to your medication. But we know that a lot of times doctors are hurrying to stay on schedule, or sometimes they may already be behind schedule. And they may accidentally forget to kind of give you that summary or fully explain what you need to know. So you most certainly can ask your doctor to give you a brief verbal summary of what's been discussed. Diagnosis possibilities or any diagnosis that they've ruled out, symptoms to look for, activities to do or not to do. You can also let the doctor know that you would like them to explain any kind of follow-up that you may need to do now, including any forms for new lab tests, if they need to give you those forms. And you may also ask the doctor to give you an idea of when you should have your next appointment if they forget to do so before they walk out of the room. Before you leave, you'll also want to, make your follow-up appointments. So you want to make sure you're making those appointments before you leave the doctor's office, that you make sure that you have that set time. So you don't forget about it, so that you're able to see the doctor on time. Because again, if you're seeing a specialist, we know how quickly their schedules book up. And like I said, it just really will help you remember to keep that appointment and keep you going and keep you hopefully healthy, because you're seeing the doctor on a regular basis. And so I also included this slide here because I think it's important to remember that you are your own best advocate. And so if you don't feel heard by your doctor, it's important to take a deep breath and politely and firmly insist that your symptoms are real and you would like further evaluation. But being your own best advocate is the best way that you can empower yourself, even empower family and friends to help you give you the support that you need. But it's a way to ensure that your needs are being addressed. No one knows your body, your emotions, and your mental stresses as well as you do. And then we have, I just put some different resources here, lessons from health advocates to improve care experiences, your right to hurt and be heard, and getting the most from your medical appointments. So that way you just have some good resources. Even if it's not for lupus, that'll help you get your point heard by your doctor if you're having difficulty being heard from them. So I know that a lot goes into preparing for your doctor's appointment. It's not only important to prepare for your doctor's appointment, but be an active participant during and after your appointment so that you can get the care that you need. Every doctor's appointment is your opportunity to explain and discuss your problems and concerns with someone whose job it is to listen and to help. The better prepared you are for the appointment, the better you will feel about the experience and the closer you'll be to receiving an accurate and timely diagnosis. So I just want to thank everybody for tuning in, and I want to apologize. Hopefully everybody could hear that last part much more clearly, and I will let Carla take it from here.
Fantastic. Thank you so much, Ashley, for that great and thorough presentation. And as you can all see, this is a great example of why NeedyMeds is so proud of our partnership with the Lupus Foundation of America. And as Ashley said, I do want to remind everybody, since this is Lupus Awareness Month, please check out their website because it is chock full of much more information if you are already living with that diagnosis. A reminder for everybody, if you have any questions, I see a bunch coming in now, you can feel free to go ahead and submit them to me by typing them in the questions section of that GoToWebinar control panel. A reminder, if we don't get the chance to answer your specific question, you will hear from us via email. But we'll leave the contact information for NeedyMeds and the Lupus Foundation should you want to reach out to either of those organizations sooner. And as those questions are coming in, I do want to remind everybody that NeedyMeds is here as a source of support too. Something that can be stressful is having an obstacle when it comes to being able to afford your healthcare expenses, including but not limited to medications. What you're looking at on your screen is the list of all of the healthcare cost savings programs that will pop up if you let your mouse hover over that patient savings tab on NeedyMeds.org. You can also reach out to our expert call center counselors if you would prefer to speak to an actual person. They are at 1-800-503-6897 and available Monday through Friday, 9 to 5. We are located in Massachusetts, so don't forget that we're on East Coast time, and we do have Spanish-speaking counselors. As some of the questions are coming in, I'm going to go ahead and leave up the contact information for Lupus Foundation of America, as well as NeedyMeds at the bottom. And a couple of other things I do want to mention before I ask Ashley those questions that are coming in from the audience is Ashley provided a lot of really great information that you may want to refer back to. So don't forget that there's a copy of her PowerPoint slide deck in that handout section of your GoToWebinar control panel. One other resource that was not on my list that I think is worth mentioning, that NeedyMeds does offer Health Storylines, which is a free app that helps you to manage your health as well as the health of a loved one. Health Storylines can act as a symptom tracker, a weight tracker, an activity tracker, and it offers other resources, other helpful tips, such as using the Health Storylines as a pain rating scale. It does have the NeedyMeds drug discount card preloaded into it, and it does link with other activity trackers, such as Fitbit. If you're interested in downloading that, you can do it free through Google, and you can find a link to it on the homepage of the NeedyMeds website on the left-hand side. And again, the name of that is Health Storylines. So some of those questions are coming in are really good ones. Ashley, here's a great one. How can I get names of my previous doctors so that I can get my medical records? I've seen so many doctors over the years, I forget their names.
That is definitely a great question, and I think that it really shows the importance of moving forward, why it's so important for people to keep a binder of their health records for their medical history. But, you know, in order to get those doctors' names, I think one good way would be if this person remembers who they may have had health insurance with at that time, the carrier, you can try contacting their customer service department and asking for explanation of benefits, or sometimes you'll hear them called as EOBs. And those explanation of benefits should include providers' names. So you should be able to pull those EOBs for a set period of time, and you can pull their names off of there in order to be able to get medical records transferred from them.
Very helpful, and that's a great question and a great answer, because I would have never thought to do that. Another question coming in is, my provider is always in a rush during my appointment, and unfortunately that's probably something a lot of us can relate to. How can I get him or her to listen to my concerns?
Okay, yep, definitely a great question, and probably the main point of why people probably turned into this webinar. And I think, again, it's just really important to clearly communicate what you need when you're scheduling that appointment. And so keep in mind that different types of visits have an assigned amount of time for their provider per patient. So whether it be an annual appointment, a problem visit, a new patient appointment, they all have different times allotted to them. So if you're as clear as you can be with communicating those needs when you schedule your appointment, hopefully you'll be able to get a longer appointment time. Sometimes you can also try being the first appointment of the day or the first appointment after lunch, because the doctor's usually not running behind at those times. But you can also ask the office staff if the doctor also does any type of consultations in their office outside of the exam room, if you have a long list of topics to discuss. And like I said, every office is really different. But hopefully by communicating what you need and what your concerns are, like I said, if you have a long list of questions, it might be more ideal to either schedule multiple appointments or ask if you can do some type of longer consultation with the doctor. Everyone, just in case you can still hear us, I wanted to apologize. There seems to be some type of technical difficulties, but again, if you have any questions, you can feel free to submit those and we will reach back out by email. And thank you so much again for attending today. Have a great day.